So rotator cuff is a group of muscles that takes their origin from the shoulder blade and attaches to the humerus. I mean, they're the muscles responsible for lifting your arm and twisting your arm as well. So it is like a real cuff, like a group of tendons, flat tendons that just cover the humeral head. Usually when people rupture rotator cuff, it's either after a fall or a stretch. That is a traumatic rotator cuff tear, or it is wear and tear over time with chronic impingement, and it tends to dig a kind of hole inside the tendon, and suddenly at a certain point the whole tendon ruptures and just detaches from the bone. The most common symptom is really the pain. I mean, the pain whenever you want to lift something, or even the pain at night. I mean, just turning yourself in the bed. The second would be the weakness.
My work is to write music, compose, and I work a lot on the piano and with guitars and percussion. I need my arms quite a bit, and on bigger productions I will have to conduct an orchestra, and doing that movement was just impossible for me.
I'd say that for a large number of rotator cuff tears, especially the small ones, only a few millimeters, on people with no symptoms at all, no surgery is needed, maybe rehab. Surgery becomes necessary when someone has a traumatic tear in which there is a lot of weakness and many centimeters of tendon has been ripped apart from the bone. These people, they should be operated on as soon as possible. The second class of people who will need ultimately surgery are the people with progressive tear with impingement with chronic pain. I mean, the only way sometimes to relieve their pain would be to go for the surgery. All the rotator cuff repairs that I do are done under arthroscopy. So I bring people in the operating room with regional anesthesia, no complete anesthesia, and we just fit a camera inside. We find out the tendon has been ripped apart from the bone. We just take it back on the bone and hold it either with a tiny implant like this called a suture anchor, or through sutures that we pass through the bone.
Surgery went really well. We were scheduled somewhere around 11 o'clock in the morning. I showed up at 9:30, and by 12:30 I think I was out. And I was out of there, and my wife was bringing me back home. The recovery was quite easy. Maybe a week after I started working again, I mean very slowly, but and 3 or 4 months after I started hitting the tennis ball again, and now I just have like full mobility. Actually, I have a better mobility than before my accident, which is amazing.
The shoulder is a joint that heals extremely well, but unfortunately extremely slow. So usually right after the rotator cuff repair, people become functional again within a few days or weeks. We control the pain easily. They can use their arm for driving, for eating, combing, and taking care of the hair. But the full healing of the tendon takes about anywhere between 4 and 6 months.